A nice addition this year to our weekend programming on the CJAD 800 has been Health Matters, Sundays at noon, immediately following the trivia show. And Health Matters is hosted by Julie Quenneville, who heads up the MUHC Foundation, and she's on the line. Julie, good morning.
Good morning. Thank you so much for the invitation.
Let me start by asking you this. Normally, in a non-pandemic year, how would you be spending your Boxing Day and this week between Christmas and New Year's?
Normally, what I would be doing this week is I would be visiting each and every patient on the units within the hospital and wishing them Merry Christmas. So unfortunately, this year we were not allowed to do that. And so we've been distributing some gift baskets to them through the nurses and wishing them well.
Very nice. Julie, congratulations on the show, by the way. I listen to Health Matters as I drive home on Sundays from the station. It's so informative, a lot of great information. And of course, you have these top-notch guests, I guess, thanks to your access to some of the best medical professionals in the city. There's always someone so interesting on the show.
I really do have the best job in the world because I get to hang out all day long with these incredible, brilliant minds. And so that's the point of the show, is to bring some of these brilliant scientists on the show to talk about where science is going and more important, how does it impact the community and the patients.
With Julie Quenneville from the MUHC Foundation, 2020 has been a tough one for so many organizations who rely on the generosity of Quebecers in order to keep doing their good work. The foundation was no exception, Julie. You and your team had a challenging year. Tell me a bit about that.
Yeah, the philanthropy sector in general has seen drops between 30 and 50% across the country. And so those are really big numbers. And unfortunately, this is when the community actually needs us most. Many of the corporations are fighting for survival, so those contributions have dropped. But there are so many people who need our help right now, and that's where the philanthropy sector really comes in. And this is such a great opportunity for us to reflect back on why philanthropy was even created before the tax receipts and foundations even existed. It's really about people helping people. And this pandemic has reminded us about the importance of our community. So this is a great reason to give back. And I remember even back in the days before the philanthropy was an official business sector, my grandmother used to walk the streets for the women's movements, and she welcomed students in from her small village, and they used to come into the big city for their education and to find work, and she let them stay for free. She didn't have any money herself, but what she felt was that it was her responsibility to help her community, and that she used to tell me all the time, there's always somebody who needs it more than you.
Yeah.
And today we are all suffering through this pandemic in a variety of different ways. But it's such a great opportunity during the holidays and as we're reflecting on the year that's passed and looking forward to 2020 ending, that there are other people around us who really need our help. And that's how we can make a difference. We're not just vulnerable bystanders in this pandemic. We have a huge opportunity. We need to feel empowered and contribute back and look at which neighbors we can help and which foundation can help us to achieve those goals.
What a wonderful story about your grandmother and that act of kindness. That was passed down through the family, obviously. Can you give me a reset, Julie, or a reminder about what the government does fund when it comes to a place like the MUHC and what it doesn't fund?
What a great question. Yeah, the government really pays for quality health care. But what it does not contribute to is innovation. And that's really the philanthropy world. And every prime minister and minister of health has always said that if there was no philanthropy, there would be no innovation. So we provide the seed funding to prove that the concept works, and then the scale up is provided by government. We're so much more flexible and agile than governments could ever be. So let me give you a concrete example. We contributed, with the community's help, more than $7 million since March in COVID response through our COVID emergency fund. So we provided seed funding for about 50 different projects, and millions of dollars were then contributed by the federal government to be able to scale these up. So a concrete example of that is the reason the COVID testing was so problematic at the start of the pandemic is all of the tools, the chemical reagents, the swabs were all produced internationally. But when the borders closed, we had no access to that. So a couple of scientists from the MUHC McGill got together with private companies, and we funded $150,000, and they created the first Canadian ability to produce chemical reagents for testing. And then the federal government came in and paid for 30 million of those. And so what a brilliant partnership that we were able to rapidly, within the first couple of weeks, get this project ongoing, show the way to the government, and then the government could, of course, scale it across the country for us to benefit.
Just wrapping up with Julie Quenneville. She is the host of Health Matters, Sundays at noon here on CJAD 800, and she is the president of the MUHC Foundation. So, I wanted to get you on before the end of the year because if someone wants to make a donation to the MUHC and give a little back, this is a good time to do it before the end of the year, right?
It's a wonderful time because, of course, we're going to do our taxes early on in the year. And so you can get your funding back in your taxes very rapidly. So it's a perfect time of the year to make your donation and then get it back and feel good about it, too. We spend so much money on Christmas gifts and on holiday events. This year there are no parties, so maybe take that budget, Ken. Take the budget that we would normally be hosting celebrations and parties and invest that into helping our community and helping those who need it most.
Just as I let you go, Julie, I imagine the mood and morale noticeably better at the hospital now that we've started the vaccine rollout?
There's finally some hope, Ken. It was, as the vaccine has begun to roll out, it's not as though the 12,000 employees of the MUHC are already vaccinated, but now there is an end to this pandemic. It has been extremely difficult and exhausting emotionally for the staff who have been on the front lines and who've been putting themselves, but even more important, their families at risk because they come home and there's a risk factor for the entire family. And remember that in March when this all started, we knew absolutely nothing about this virus except for what we were hearing from physicians in other countries who were hit a little bit earlier than us. So the vaccine is coming, and we hope that by the end of March, all of the staff will be vaccinated, at least the ones on the front line, and we will be able to make it through in 2021. And hopefully you and I and everybody else will be hopping back onto planes in the near future and gathering together to celebrate.
Hear, hear. I'll raise a glass to that. Julie, all the best to you and your family and your team as well for 2021. Happy New Year.
Happy New Year to you. Thank you so much.